May I please have your first name and date of birth?
Harita.
Harita.
Date of birth is August 20th, 2002.
Okay, Harita. Very nice meeting you. When is the last time that you had a head-to-toe examination performed?
I think it might have been 2 years ago.
2 years ago. Okay, so you're about due to have one.
Yeah.
Are you on any medications, Harita?
I'm not on any medications.
No medications. No supplements, nothing over the counter? No. Do you follow a certain diet?
No.
No. Okay. When is the last time that you had your blood drawn and, had any blood panel done?
I think it was when I was younger.
Younger. Okay. So I'm going to put in an order for that. We're going to check your vitamin B and D levels.
Okay.
And also get a liver function test done, as well as a thyroid function. It's just good to do those on a regular basis. Do you have any medical history I should be aware of? Any major surgeries?
No, I don't have any medical history.
No. Okay, so pretty healthy overall.
Yeah. I have been feeling very tired recently, pretty fatigued.
Okay.
So that's just...
So this is a recent symptom that you've been experiencing?
Yeah.
Okay. And about for how long have you felt this way?
A month.
A month, okay. Do you have any idea what could have contributed to you feeling tired?
I'm not sure. I'm studying every day and I'm working every day too. So I assume it's probably that.
Okay. So lots of brain stimulation, using your brain a lot. And how are you sleeping at night? How many hours do you think you get?
3 to 4 every night.
I
have been pulling a few all-nighters for studying too.
So 3 to 4 hours a night is definitely not enough. I recommend you try to sleep for at least a minimum of 6 hours. So that could be why you're feeling so tired, for sure. Okay. Have you experienced any headaches, any blurred vision, double vision, any symptoms that are...
The headaches a lot.
Headaches a lot?
Very frequent.
Okay. How often would you say you're experiencing those?
Every other day, every week.
Okay, so
it varies.
That's pretty often. And on a scale of 1 to 10, how intense are they?
It really just depends. Some days they'll be really intense, and then some days it'll just be light. But I'll just feel it in the back of my head.
Okay, in the back of your head. Like right here? Okay. And are you taking any medication, any painkillers for them?
No.
No painkillers.
Yeah.
Okay. How is your water intake? Do you feel like you're drinking enough water throughout the day?
I'm trying to, but I don't think I am.
Okay. So I definitely recommend anywhere between 6 to 8 glasses of day, so like full glasses of water per day. Okay. Do you exercise regularly?
No.
No. Okay. Do you use tobacco or alcohol on a daily basis or regular basis? Any difficulty breathing?
No.
Okay. So studying a lot, headaches, and feeling tired. And after you sleep the 3 to 4 hours a day, a night, do you wake up feeling okay, or do you wake up feeling a little bit groggy? And
I definitely feel groggy. I don't want to wake up.
All right. Well, hopefully you're going to take your exams and then maybe relax a little bit and not study so hard.
Okay. Yeah.
Do you have an end in sight for that?
an end?
Yes, maybe the end of the school year or
Yeah,
a vacation coming up soon.
After its finals week's coming soon, so after that, I'm hoping to just kind of relax a bit and take all the stress out.
Good, so something to look forward to.
Yeah.
All right, I'm going to go ahead and start by taking your vital signs first. So I have here an oximeter that's going to go in your index finger. So your index finger goes in there. You can just relax your hand. And that's going to tell me how well oxygenated your blood is.
Okay.
And I'm going to check your temperature. Any flu-like symptoms in the last 2 weeks or so?
I don't believe so. It's just the headaches, really.
Just the headaches? Yeah. Okay. So let's check your temperature. Right behind the ear. 98.6. So definitely you do not have a fever. And I'm just going to check your pulse over on this hand. Okay. I can definitely feel it about 65 to 70. Okay, that's normal. And 99% oxygenation and 80 beats per minute with the oximeter, so that's quite normal. We'll just take a couple of notes. Normal temperature, pulse. Okay. Also going to listen to your heart and take a peek to your lungs.
Yeah.
Is that okay?
Yeah.
Just going to move your hair out of the way. And you can just breathe normally. Okay. And I'm looking for any murmurs. Any sounds that should not be present. Okay. You can just close your eyes and relax. Good. So I'm able to hear S1 and S2. Not hearing S3 and S4. No murmurs or adventitious sounds. Good. Now take a deep breath in and out. Deep breath in and out. Okay, I can just breathe normally now. No crackling in the lungs, no signs of any bronchitis, no wheezing. Okay. So, heart and lungs sound perfectly okay. I'm gonna set my stethoscope aside, make a note. Any heart palpitations at all? Anything bothering you with the heart?
No.
No, good. Okay, so that's all quite normal.
Yep.
I'm also going to check your blood pressure. Okay. Have you ever had this done before?
Yes, I have.
Okay, so you know what to expect. I'm gonna go ahead and slide this over your right arm. Right here. Good. And let's uncross the legs. Good. And if you could hold this right here for me. to check your pulse. One more time. Okay, quite normal. And now I want you to raise this arm and make a fist and kind of just open and close your fist 10 times. Okay, to circulate the blood. Okay. All right, you can lower it now. And I'm going to take your blood pressure next. You can put your arm right there. There you go. And if you can lift this up for me so I can see it. Yeah, perfect. Okay. Good. So 110/60. Blood pressure is a little bit on the low side. Right. So I'm gonna set this aside and make a note. 110/60. Okay, so definitely could be a little bit dehydrated given the headaches, the low blood pressure, the overall just lack of energy and tiredness. If you're not drinking enough water, you can get dehydrated.
Okay.
All right. So I'm going to put on my medical gloves and I'll start by just inspecting your skin, your head,
Okay.
your eyes, and then work my way down your body. Okay. Do you have a headache right now?
Not too much. I had one this morning though.
This morning?
Yeah.
Okay. On a scale of 1 to 10, how intense was it?
5.
5.
It wasn't too bad this morning.
In the back of your head again? Okay. So. Let me go ahead and just do inspection of your skin. You can just relax and close your eyes. Just going to move the hair out of the way. Okay. I'm looking for any signs of eczema, psoriasis, any patches of dryness, any blue or purple colors, any obvious signs of your body being swollen, edema. Okay. Just looking on your face. I'm also checking for any moles that could be problematic. Okay. Checking the hair distribution on your eyelids and eyelashes. Okay, that's symmetric. Any asymmetries with the hair distribution could be a sign of hypothyroidism. Okay, the lips are also symmetric, no signs of ptosis around the mouth. Jawline is symmetric. Thyroid gland does not appear to be enlarged. Okay, I'm going to do a quick scalp inspection at the top of your head. I'm looking for any hair loss, any sign of alopecia, eczema, psoriasis, dermatitis, folliculitis. Okay. Hair distribution appears normal. No signs of folliculitis. Can you move your head towards your left? Very good. I'm going to check on this side as well. Okay, that's good. You do not appear to have any dandruff. No moles on the scalp. Just checking your hairline. And you can move the head over on the other side. Good. All right. Okay, scalp appears quite normal. Okay, that's very good. Alright, I'm also going to do a quick inspection for any potential infestation. Just going to be brushing your hair. And checking for the strength of the hair follicle as well. Got no breakages. Okay, well, your hair is very strong. I'm not noting any breakages whatsoever. So good level of nutrient. Good. and no signs of any infestation.
Okay.
Next up, I'm going to check your reflexes and use my medical hammer here to tap all the way from your head down your joints to your wrists.
Okay.
Okay, so just keep your eyes closed and let me know if you feel any discomfort or pain. Good. Good. Both of your eyes gave a symmetrical reflex response.
Okay.
Don't need to say anything. When I say, just let me talk. I'm also going to check your clavicles. Good resonant sound. Okay. And your shoulders. Good. Good. Alright, let's check your reflexes. That's good. Good. And leave your weight into my arm. Good. And over here, leave your weight into my hand. Your arm loose. Okay, good. And over your wrists. Good. Perfect. Okay. I'm also going to check the skin on your chest area and your arms and look for any abnormal moles or discoloration. Okay. One tiny pink mole on your chest. Is this a new one? Have you ever noticed it?
I haven't noticed it before.
Okay. So it's very small, one color, well-defined margins, a little bit raised. Gonna keep track of that one. Okay. And one mole over on your arm. Have you ever noticed this one?
I think so.
Okay. One color not raised. Other than that, no other moles. Okay, let me check the inside of your arm as well. Okay, another mole. Not raised, one color. Looks quite normal. Good. No signs of psoriasis or edema. Okay. Normal color of the skin. No dermatitis. No signs of palmar erythema or red palms on your left hand. No signs of palmar erythema on your right hand. Capillary refills within 2 seconds. No nail clubbing or pitting. Good. And capillary refills within 2 seconds. Good. Okay, we're going to just palpate your arms. Check for any edema or swelling of the hand. Okay, none noted. I'm going to palpate your face and your lymph nodes next. Okay. Starting with the preauricular lymph node and the posterior auricular lymph node. Good, mobile, not enlarged. Superficial cervical, deep cervical, posterior cervical, and occipital in the back, not enlarged. Okay. Parotid, tonsillar, submandibular, and submental. Good, not enlarged. Okay. Okay, let me check your thyroid. Not feeling any nodules. Can you look up and swallow? Okay. Moves up and down, barely palpable. Good. Checking your supraclavicular lymph nodes. Okay. Mobile and not enlarged. Okay, that's good. All right. Okay. Going to check your eyes next. Okay. Can you keep them closed? I'm going to just palpate on the outside. And open them. Good. And look towards the wall over there. I'm going to check for the pupil response, but this light is not strong enough. Done. Okay, and this one is what I need. So continue looking into the distance. Checking for the direct response. Okay. Good. Bless you. Good. My light made you sneeze. That has never happened before. Interesting. And now I'm going to check for the consensual response as well. If you can open your eyes. Good. And one last time. Perfect. And your pupil is about 3 millimeters. So it has the normal size and shape. And the contractions and the dilations are just as expected. Okay, now I want you to keep your head steady, so don't move your neck. And look right here at the light and only use your eyes. And now look at the wall behind and at the light again, the wall and the light. Now follow the light. Okay, good. Now look at this finger right here. Don't move your neck. Look at the good. And now look at the finger. Good. And now just follow the light. I'm going to check for the mobility of your eyes in all 4 quadrants. Perfect. So The eyes are moving together, synchronized movements, no skipping, no lagging. And now I'm going to bring this very close to your nose, so try to follow it as best as you can. Perfect. Okay. So we're going to do a quick vision test next. I have here what's called the Snellen chart. That just has some letters on it. Do you wear contacts?
I do.
You do? Okay, do you have them on right now?
Yes.
Okay. And when was the last time that you had your eyes checked by an ophthalmologist?
I think it was maybe a year ago.
A year ago. Okay, so let's see how you're doing.
Okay.
So I'm going to place this about an arm's length away from you. And can you read the bottommost line?
LTFPH.
Very good. And what color is this?
Red.
And this?
Green.
And what number is this?
4.
And this?
9.
Good. Now can you please cover one eye? And can you read the second to the last line from the end back to the beginning?
JHDFC.
Okay, perfect. Now can you cover the other eye? And read the bottommost line from the first letter to the last.
LTFFH.
Good, very good. So 20/20 vision.
Okay.
Okay. Now I'm going to show you some shapes and colors at the periphery of your field of vision. So I want you to look forward at the wall behind and keep looking at the wall. Don't use your neck, and try to see if you can spot the card that I'm showing you, and tell me the shape and the color that you see. Don't look at the cards. No cheating.
It's a heart. Pink heart.
Perfect.
A green, a blue, purple triangle.
Very good. Going to bring it at the bottom.
A yellow star.
Very good. And let's see if you can do from the top.
A red heart.
Very good. So binocular peripheral vision is intact.
Okay.
Okay. I'm going to focus on your ears next. Have you had any problems with your hearing, any tinnitus, any abnormal sounds, ringing that comes and goes?
Sometimes there's a ringing that comes and goes.
Okay. And when does that happen?
When I listen to music, like after I listen to music for a while.
Okay. Have you always had that, or is that a recent symptom?
So it's been there for a while.
Okay. When you listen to music mostly, does it come just out of the blue when you're not listening to any music?
Yeah, sometimes when I put my headphones in after I'm done listening to music.
Okay. So I'm going to make a note of that. The chart. So I'm going to just look at your ears first and inspect the ear oracle. Can you move your head towards that side, your left? Okay. Okay, so note discharge on the external ear oracle. The back of the ear looks okay. Any pain when I pull down on your ear? I move up. Lateral. Okay. Let me look at this other one as well. Any pain here? Here? Okay. Good. Okay. I'm pressing down on your mastoid bone process behind the ear. Do you feel any pain there? Okay. So the outside of the ear looks perfectly fine. I'm going to take a peek inside. And I'm going to use my otoscope here to just visualize your tympanic membrane and the inner canal of the ear and your inner ear. Keep your head towards your left. You have tiny ears. So I'm going to be as gentle as I possibly can. Okay. And you must have some of the cleanest ears I've ever seen. No wax, no buildup. Tympanic membrane looks healthy, pearly gray color. No sign of any cerebral fluid buildup in the back of the ear. No inflammation. Good. I'm going to take a look inside this one as well. Okay. Inner ear looks healthy. Bony landmarks are present. Tympanic membrane. Well-defined margins. And the expected pearly gray color. Good. So I'm not seeing anything concerning with your ears. But we'll monitor that sound. So I want you to maybe use a journal, and every time you hear it, just make a note of how loud it is and what you were doing while you were hearing the sound. Okay. I'm also going to test your hearing next. So keep your eyes closed. And did you hear the sound? Okay. Now I want you to tell me if it comes closer to you or if it moves further away.
Coming closer. Coming closer. Now it's further away.
Okay.
Coming closer. It's moving further away.
Good.
It's moving further away.
Good. Okay. Next up, I'm going to use my tuning fork here and strike it to cause a vibration. And I'm going to place it on top of your skull here. And I want you to tell me if you hear and feel the vibration in both sides of your head and if you hear it with both of your ears. Okay. Do you hear it?
Yes.
Equally with both of your ears?
Yes.
Okay. Now I want you to tell me when it stops.
It stopped.
Good. Okay, I'm going to do the same thing and place my tuning fork next to your ear in two positions. This is position 1 and this is 2. Which one is louder?
2.
2, good. Position 1 and 2.
2.
2 is louder, good. So your hearing is perfectly okay. I'm going to just make a couple of notes. So inner ear looks healthy. Bony landmarks were visible. Tympanic membrane was healthy. And no signs of any infection. Okay, next up I'm going to focus on your nose and your mouth. Have you noticed anything abnormal with your nose, your sense of smell?
No, I have not.
No. How about your taste? Do you usually taste sweet, sour, bitter, all of the tastes? Yeah?
Yes.
Okay, good. So I'm just going to palpate your nose first and check for any nodules, any deviation of your septum, I'm going to obstruct one of your nostrils. Take a deep breath in. Okay, and out. Okay, good. And deep breath in. Oh, sorry. And out. Good. So nostrils are not obstructed in any way. Bridge of the nose is straight, no nodules. Any pain here? No. Any pain when I do this? No. Good. Okay. I'm going to give you something to smell. Do you smell this? Okay. What is that? Smell?
Cocoa.
Good. Okay. I'm going to take just a swab of your nose and test for any potential viruses or anything just on the outside. Okay. Good. Okay, so I'm going to send this to the lab. And let's see your mouth. Can you open your mouth? Okay. Teeth are intact. Can you stick out your tongue for me? Okay, pink color. And now say ah. Okay, no inflammation in the back of your throat either. All right, next up I'm going to test your dermatomes. So dermatomes are areas of the skin that are innervated by the same spinal nerve root in your spine. So we're going to do a test that's called sharp or dull. May I please have your palm? So this is dull, this is sharp, and this is always sharp. This is very sharp, and this is just sharp. So I want you to keep your eyes closed and tell me if you feel dull, sharp, or very sharp. Dull. Okay. Sharp. Very sharp. Sharp. Dull. Very sharp. Very sharp. Very sharp. Dull. 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 Sharp. Dull. Dull. Very sharp. Okay, so V1, V2, V3, C2, C3. Very sharp. Dull. Sharp. Okay, C4. Dull. Very sharp. Dull. Sharp. Very sharp. Sharp. Very sharp. C4 and C5 are all clear. Going to check your scalp as well for C2. Very sharp. Dull. Sharp. Very sharp. Very sharp. Sharp. Okay, C2 and C3 are clear. Next up, I'm going to test your sensitivity to cold or hot. So keep your eyes closed and tell me if you feel hot or cold. Cold. Good. Hot. Good. Hot. Good. Cold. Hot. Hot. Cold. Cold. Good. Hot. Cold and hot. Good. Okay, next up I'm going to test the elasticity of your skin. So I'm just going to clip you with my little tool here. Just keep your eyes closed and relaxed. Okay, good. 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 Okay, hurry down. Next up, I'd like you to lay down so I can take a look at your tummy, your back, your legs, and your feet. Okay, you can keep your arms parallel to your body. Just going to listen to your tummy first. Okay. I'm looking for any gurgling, any swooshing sound. Okay. Good. So the abdominal sounds are quite normal, just normal bowel activity. I'm going to just palpate your tummy and feel for any lumps or bumps. Okay, good. Some normal stomach activity. Did you have breakfast in the morning? You did not? Okay, maybe that's why. Your tummy's just hungry. Okay. So I'm not feeling any lumps or bumps. just going to tap on your abdomen and check the resonance sound. Okay, good. Yeah, your tummy is quite empty. Also going to take a couple of measurements. Your arm is 72. Your left arm is 73. 34 across the abdomen. 44 across the shoulders. 45 from your belly button to your left shoulder. 48. Okay. So now I want you to flip face down so I can take a look at your back. I'm going to do just a quick scalp inspection over on the back of your head here. And take a look at the hairline. Okay. So the back of your scalp looks okay as well. No signs of psoriasis, no folliculitis, dermatitis. Do you feel this? Do you feel this? Is it sharp or dull? Sharp or dull? Dull. How about this? Sharp. This? Okay. Sharp or dull? Sharp. this warm or cold? How about this, warm or cold? Good. Is it sharp or dull? Sharp. Okay, how about this? Sharp. How about this? Sharp. And this? Okay, good. Okay, I'm going to inspect your spine next. Just going to palpate for integrity and check for any nodules, lumps, or bumps. Spine is straight, cervical, thoracic. Lumbar spine is straight as well. Okay, I'm going to percuss. Okay, very good. I'm also going to just check the skin on your back and the elasticity. Okay, good. 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 Normal elasticity. Skin contracts just as expected. No redness, that's abnormal. Body fat is within normal range. Okay, going to check your legs next. Okay, I'm checking for any psoriasis, eczema, dermatitis. The plantar region is quite clear. Good. Can you wiggle your toes? Okay, how about now? Can you wiggle them? Perfect. Okay, I'm going to feel for any edema or signs of swelling in your legs. Okay, check for any pain in the plantar region. Check the calcaneus region on your heel. Good. And next up, I'm going to check the nerves, so the dermatomes in your legs and the plantar region of your feet. Do you feel this? Yes?
Mm.
And do you feel this? Okay, is this sharp or dull?
Dull.
Okay, how about this?
Very sharp.
Very sharp, good. How about this? Is this sharp or very sharp?
Very sharp.
Okay, and this?
Very sharp.
This?
Very sharp.
How about this?
Dull. Dull. Sharp. Sharp.
Okay, let's try that again.
Sharp. Dull. Sharp.
Good.
Sharp.
Good. Okay, how about this? Is it sharp or dull?
It's very sharp.
Do you feel this?
Very sharp.
Okay, those toesies are good. Do you feel this? No? How about this? Do you feel this?
Very sharp.
Good. This?
Sharp.
And do you feel this?
Dull.
Good. Okay, so the dermatomes in your legs are normal. I'm going to do the Babinski test next. Okay, that's negative. And here as well. Okay, good, negative. I'm going to tap on your legs next. Let me know if you feel any discomfort or pain, any zapping. Okay. Good. 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 Okay. All right. Okay, Harita, so this concludes the head-to-toe examination for today. I haven't found anything that would require us to further investigate. I do want you to get your updated blood panels, liver function and thyroid function done, just so that we're up to date with your blood test. Do you have any questions for me?
I don't.
Okay. I do recommend you trying to get more than 3 to 4 hours of sleep per night. So if you can get to that, that would be great. It should improve the tiredness and just re-energize you. And try to take some vitamins as well if you can. Just over-the-counter regular vitamins. All right.
Thank you.
Good to see you today.
Thank you.